Yep. Makes total sense. And I agree completely. No doubt about it. So moving on to your academic achievements and honors. You had your honors in vulnerable populations. You received your honors in vulnerable populations at the University of Pennsylvania. And according to the UPenn program catalog, I did a little research. This honors program is described as honors in vulnerable populations focused on providing comprehensive care to refugees, survivors of torture, asylum seekers, and survivors of intimate partner violence. Tell me more about what was involved in earning this honors.
Sure. So, um, in my fourth year of dental school, I started working in this clinic. It was a half a day a week. So Wednesday afternoons, normally I would have Wednesday afternoons off, but I would go to the vulnerable populations clinic, and just provide care to those populations that you mentioned. We have a partnership with NSC in Philadelphia. It's Nationality Service Center. And they're the ones that are connecting a lot of those immigrant and refugee populations with medical and dental care, along with, other resources and opportunities. And then, we do treat other populations as well, like survivors of domestic violence. And there is a clinic at Children's Hospital of Pennsylvania that we get referrals from, and they work with sex trafficked youth. So there's a lot of, these vulnerable populations that we're treating. A lot of the patients don't speak English, so we're working with translators. They're basically like iPads on wheels. So that was there was definitely a learning curve there, working with a translator. And I learned how to be a really effective communicator, and breaking things down, really making sure that nothing got lost in translation when we were talking about diagnoses and treatment plans with these patients. Something that I really learned in that clinic was how to build over time a really trusting patient-provider relationship. Always had trauma-informed care in mind. So we wanted to make sure the environment was comfortable. We were taking things slowly, asking questions along the way. If you think about it, laying down in a dental chair with somebody just hovering over you, that's a really vulnerable position to be in. A lot of times think about if you have the rubber dam on in your mouth, or a bite block you can't close. So we actually strayed away from using a lot of those tools. We were always working with an assistant. So we achieved isolation in other ways, rather than using a rubber dam or things that might make someone feel claustrophobic. But a lot of those patients that we treated, they had very complex dental needs. And their treatment plans were extensive. So a lot of our patients, it took us a full year to finish their care, and some of them are, getting passed on to the next group of students doing this program. So we had to just always be over communicating everything, reestablishing the goals of treatment at the beginning of an appointment, and making sure that the patient was comfortable along the way. It was a really unique experience. I had a lot of patients who were refugees from Afghanistan, Russia, Ukraine, and they had been through a lot. So we had to work to build trust, for sure, in our patient-provider relationships. And it took time, but it was so rewarding at the end to see them achieve their dental goals and restore their oral health and their confidence as well.
That is so cool. I'm just thinking when you're talking about all the different, populations that you saw, and the vulnerable people that were sitting in your chair, I agree 100% that, of course, being laid back in a chair and having not just a person hovering over you, but a stranger hovering over you with a mask, it's a very intimidating experience, especially for people who've been through a lot. So I can only imagine that from your perspective, you mentioned that due to a lot of the language barrier, as well as the need to communicate, like, and you said over communicate, it's such an interesting balance that I'm hearing of you needed to simplify things in your mind so that they could understand it and the translators could understand it. But also you wanted to over communicate so that they felt comfortable and the entire process was crystal clear.
Right.
How I can't imagine what it must have been like to strike that balance. That must have been so difficult.
It was difficult. We would have to, I mean, in dental school, things move a lot slower than in private practice. We would especially take our time though in this clinic. We would, especially in the beginning, set aside 4-hour blocks for one patient. And I remember we would spend with some of our patients up to 30 or 40 minutes in the beginning of the appointment, kind of just talking and re-explaining what we're doing, pulling out the model and pointing at the areas of the mouth we're focusing on, asking questions about their preferences in treatment. And a lot of these things we had already discussed, but we bring them up again because we want to be on the same page at every appointment. You never know when, the translator explains something to them and they're like, okay, yeah, but I don't know what the translator said. So I need to confirm at every step of the way that we're on the same page. So it really was just a matter of slowing everything down.
Wow. Well, in terms of training the future comprehensive dental care dentist, I can't imagine a better exercise than learning how to communicate and over communicate while also simplifying what's being said. What an amazing exercise.